Good morning, everyone. My name is Maddie Bunting, and I am the Dean's Chief Student Ambassador at the UC Riverside School of Public Policy. I am delighted to welcome you to today's online seminar with our special guest, Dr. Derek Brinkerhoff, who will be discussing citizen empowerment and accountability for service delivery, lessons for the U.S. from Indonesia. The first half of our event will be devoted to a presentation by our guest speaker. We will then devote the last half of the hour to an audience Q&A. For that Q&A, I have also invited fellow classmates to ask questions as part of a roundtable panel with our guest. Audience members, if you have any questions you would like to pose during the Q&A session, please do not send them via chat, but instead please use the Q&A feature, which you can find at the bottom of your screen. You can submit your questions anytime throughout the event via the Q&A feature. You do not have to wait until the audience Q&A to do that. So without further ado, I would like to introduce our special guest this morning Pacific time, as Dr. Brinkerhoff is on the East Coast. Dr. Derek Brinkerhoff is a distinguished fellow emeritus with RTI International and is an associate faculty member at George Washington University's Trachtenberg School of Public Policy and Public Administration. Dr. Brinkerhoff is an internationally recognized practitioner and scholar in the field of public management and governance, with over 40 years of broad and in-depth experience with policy analysis, program implementation and evaluation, organization and management, decentralization, and democratic governance issues in public sector agencies and nonprofits around the world. He has undergraduate and master's degrees from UCR and a doctorate in public policy and administration from Harvard University. We are delighted to welcome him back to UCR today. Dr. Brinkerhoff, the floor is yours.
Well, thanks very much for that nice introduction, Maddie. So let me go ahead and share my screen here and we'll get going. Okay. So as Maddie said, I'm going to be talking about some work that I was part of in Indonesia, but thinking about what are the lessons that we can draw from other countries for public policy and public administration in the US. There's been a traditional split between scholars who study the US and other countries. There's been a long history of considering the US to be exceptional and not much that happens in other places is applicable to us. But that I think has changed over time. And so the sense that the US was very different from both the global north, which includes US and the so-called advanced economies, and the global south, which is the sort of blanket term for the developing world. Those boundaries now are a lot fuzzier. And among the reasons for that is that there's a new set of countries, and you may have heard of the acronym called BRICS, which stands for Brazil, Russia, India, China, and South Africa. So it's another categorization of countries that fall between what used to be this idea of advanced industrial countries and developing and poor countries. And these countries have different experiences in public policy and in public administration. And then there's also the feature that's often looked at called the fact that there is the South in the global North, which essentially means that there are pockets of poverty in northern countries. And similarly, you can talk about the North in the global South, and that there are economic and political elites in poor countries that have as many resources available to them as people do in advanced countries. So this means that there really are not as many differences as might immediately come to mind. And certainly there are scholars now who very much look across boundaries to see where there are lessons both for the US and for other countries. So that's kind of the question that we're going to talk about today. What can we learn from other countries that can apply to the US? And I'm going to talk about a project that essentially looked at how citizens were engaged in service delivery. And this is a category of interventions that are called social accountability, which has to do with citizens' collective actions to focus on how to improve public services. And there are lots of different definitions of this, but among the features are citizen engagement in monitoring and oversight of service provider performance, citizens helping providers to identify problems and bringing those to the attention of decision making. And then slightly more active is the idea of participating in decisions around budgeting, resource allocation, planning, and service delivery itself. And then in cases where performance is not up to what citizens would like, seeking some kind of redress for errors or things that have been overlooked. So this is just a table that illustrates some of the kinds of actions that fall under this broad label of social accountability. And I think you'll recognize in the examples some things that we see in the US, parent teachers associations, citizen review boards, protests and demonstrations. So these are going from sort of a continuum of things that deal mostly with simply sharing information, it's called the transparency side, up to engaging with providers in what's called co-production, all the way up to contentious and confrontational approaches for citizens to engage with government officials. So this is the theory of change in the study that I'm going to be talking about. So what we were looking at was the introduction of a set of social accountability tools, how those tools increase the availability of information for citizens that they could use both for advocacy and for pushing for changes in how providers behaved, and then also for how that affected change in policy. And so the idea is that we looked for evidence of improved service delivery, and then how did that feed back into changing behaviors among service providers, changing policies, and then that feedback to giving citizens more information about what providers worked on. So again, I'm tossing a bunch of frameworks at you all, but this one essentially demonstrates that there's variation in social accountability in terms of its power to hold providers and officials to account and to influence their behavior. So this slide essentially moves from the ability of citizens to not do much more than listen to what public officials say, which is sort of that opaque transparency end of the continuum here, moving towards clear transparency where officials' responsibilities are understood by citizens, and up to soft accountability, and then towards the harder end, where there are actual sanctions and punishments for shortcomings. And there again, the idea of demonstrations is certainly one of those. So this essentially simply illustrates that there's variation there. So from there, let's jump off to Indonesia. So the study that I'm going to be talking about is one that the U.S. Agency for International Development funded, and that the organization that I work for, RTI International, implemented. And this is what gave us access to the project, that we already had staff on the ground. And so those of us who were the research team came from Washington to essentially carry out this study. And what we did was we looked at 3 social accountability mechanisms that this project introduced. So one was a survey of citizen complaints about the facilities. And here we were looking at specifically at primary health care providers. The creation of a multi-stakeholder forum, which was the organizational mechanism that citizens participated in to interact both with other local officials and with the providers themselves, who were members of this committee. And what they did is, based on the complaint survey, they identified a set of problems that the facility needed to change, to address in the eyes of the citizens. And this became the basis of what was called a service charter, which was kind of like an informal contract between the facility and the multi-stakeholder forum, and that listed a number of changes that they all agreed would improve performance. So those were the three mechanisms that we looked at. And if you look at the picture, that's in one of the provinces where we were working in Aceh. So the project did the field work in March of 2014 in Aceh and West Kalimantan province, and we looked at 2 districts in each. But what you can see from this picture, which I think surprises people who aren't familiar with how the public health sector is structured in Indonesia, is it's somewhat militaristic. They're wearing uniforms. This picture I took at the morning muster as people were coming in for work. They sing a song. The head of the office, this is the district health office, gives a little talk. People salute, and then they head off to work. So you can see that the public health service there is a bit more regimented than we tend to think of in our country. So we did 60 interviews in 15 health centers in these 4 districts. And we asked questions about the context for service delivery, implementation issues, and then what some of the outcomes were. And what we were aiming to identify is what I showed you in that theory of change diagram, is were there perceived changes in service delivery on the part of citizens and providers? Was there any evidence of attitudinal changes on the part of providers, citizens, and local government officials? And how did those contextual factors influence the commitment to using social accountability tools and principles? So let's head off here to Indonesia. This just gives you a really quick snapshot of the 2 provinces and the 4 districts. So what you can see is they're pretty large. Banda Aceh is actually the municipality of the city of Aceh. So it has the largest population there. But what we were really looking for in this slide is essentially to see, were there any other reforms that had happened before this project started to introduce social accountability? And so that's what the little X's indicate. So you can see in Banda Aceh, there were some reforms that dealt with citizen participation, efforts to share information, and ways to improve the accountability of service providers. In the others, there were a couple of those items, and in that one, in the more rural district in Aceh province, there was just one. So this essentially gave us a brief little snapshot then of what the situation was before the project started. So this gives you essentially a snapshot of what people on both the provider side, so you've got the provider column and then the MSF, that's the multi-stakeholder forum. So that's the citizen side. And the letters that you see on the left-hand side, those were our anonymized labels for each of the facilities. So each row there indicates one facility. So you can see that in Banda Aceh, we were looking at 3 health centers, 3 in that other province, but then in the West Kalimantan one, there were a lot more. So in that Sambas district, we were looking at 6, and then Singkawang, we were looking at 3. So what this demonstrates, and so dark green means significant improvement, the light green, modest improvement, and the blanks, no change reported. So you can see that there's definitely some convergence there in terms of whether the citizens and the providers felt that there was improvement. And again, the improvements were based on that service charter that I talked about earlier that had listed a number of changes that had taken place. And so the way that we were able to calculate the perception was the extent to which a number of those problems had been addressed, and sort of added those up. So this is the slide that I think is among the more interesting, and I'm not sure how easy it is for you all to see the screen, but again, the facilities are listed down the left-hand side there, and the provider perspective is the red line, and the blue line is the citizens, the multi-stakeholder forums. And what's along the bottom there is, if you think back to the slide that I showed you that had sort of all the way from opaque transparency to hard accountability, that's what's along the bottom there. So on the far left was simply disseminating information, and all the way on the far right was citizens engaged in monitoring clinic performance. And so what this chart shows you is what the citizens and the providers felt was the appropriate role for the multi-stakeholder forum in accountability at each health center. So you can see the ones at the top, there was agreement between the providers and the multi-stakeholder forum that citizens had an appropriate role to monitor the performance of the clinic. But when you look down at the bottom, look at those last two centers. There's no red line. So that meant that the providers felt that there was no role for citizens. They thought that this was not the right way to go, that they as providers knew what was best, and that there was really nothing that citizens were supposed to do related to social accountability. And then you see the ones in between. So by and large, the blue line, which is as I said, is the perceptions of the citizens and their role, pretty much all the citizens felt like they should have a strong role in both overseeing and being engaged in service delivery. And the providers had, except for those 5 at the top, had a much less positive perspective on what citizens' role should be in accountability for performance. So one of the things that we were looking for, remember I showed you that slide that looked at whether there had been efforts at policies that would support social accountability prior to when this project began. So this is where we looked at a comparison of contextual and implementation factors in both sites in the green, where there was a strong convergence between the citizens and the multi-stakeholder forum's view on whether citizens should be involved or not. And then the ones at the bottom are the ones where there was a low perception of that. And so this goes back, if you look at the bottom 2 there without the red line, over here, those are the ones that are in red on the bottom. And then if you go back here, the ones at the top are the ones in the green. So there, what you can see is there was some experimentation with prior mechanisms that citizens could use to complain about service. They were effective in a couple of the sites, but you can see that they weren't effective in several others. And even in some of the ones where there was a strong convergence between what providers thought citizens should be engaged in and citizens themselves. The thing that I think is quite interesting is if you look at, in 5 of the centers, there were antagonistic relations between citizens, service users, and providers. And so there again, you get a sense that you would think, well, if they were antagonistic, then maybe those 3 centers that are in the high social accountability category, you wonder, well, how come that didn't affect them to move down to that red bar? The other column there, one of the things that came up when we were doing the complaint survey was that the clinic questioned the methodology. And so you can see in a lot of the clinics, the providers who felt that they were the technical experts said, well, citizens aren't really capable of judging the quality of care here. And so rather than listening to the surveys as feedback, they essentially argued with the methodology and essentially rejected some of it. So that took some work to overcome. Remember, I told you that the way that we measured performance was how many of the problem points identified in the service charter had been addressed. And so that's what that column over there with the numbers in it. So that shows how many of the things remaining needed to be addressed. But I think what we concluded from this, this contextual analysis was that there really wasn't a clear relationship between prior experience with social accountability mechanisms and the outcomes for social accountability that the project found. So there were similar features in situations where there were both strong and weak commitments to social accountability. So what do we do with interpreting these kinds of findings? So I think the main one here, and this is a lesson that comes up in a lot of international development, where people say, well, everything depends on the context. So certainly we would say contextual factors are important, but the effects are not consistent. So I think one of the implications here is don't assume that citizen engagement won't work just because past experiences with providers' engagement in citizens have been negative. And so what we took away from that is it would work best to try to encourage social accountability in both the conducive and the resistant contexts. And what we found in terms of when we dug a little more deeply into what was going on, we found that a lot of the impacts could be attributed to specific individuals who were supportive and motivated. So it wasn't just these sort of broad factors, but it was really down to kind of individuals. So I think this underscores the need for really taking a local focus and looking at how you can identify who's going to be supportive and who's not. So another finding was the difference between the citizens and the providers' views essentially did affect the responsiveness of providers to citizen engagement. So you think back to the chart with the blue and the red lines. And this certainly was one that, as I say, struck us very much in terms of helping to understand what was going on. So thinking about how to move some of those providers who felt like there was little to no role for citizens was helping them to recognize the value of citizen engagement on their own terms. So in terms of improving uptake of utilization of health services, for one, was something that the multi-stakeholder forum could help to do. And then coming from the broader institutional context, and remember I showed you the picture of the militaristic health workers saluting their boss at the beginning of the day. In the Indonesia situation, those individual health centers are part of a larger hierarchy of public health. And so the extent to which there were institutional incentives and sanctions for adopting social accountability and listening to citizens was important. And just as an example, in one of the districts, the regional health office offered health centers extra resources when they had demonstrated responsiveness to the multi-stakeholder demands that were expressed in those service charters. So they actually got more support, more financial support, if they focused on addressing the citizen concerns. So what can we conclude here? Certainly one is that if you align citizen and providers' attitudes towards social accountability, you're going to be highly likely to increase the sustainability of citizen engagement and the improved accountability that comes from having citizens be engaged. And so the best way to do that is to combine the bottom-up pressure from social accountability, from those multi-stakeholder forums, with the top-down pressure that comes from the higher levels in the health bureaucracy. And these can improve provider responsiveness and increase accountability. This is an approach that a well-recognized scholar in social accountability, who is a professor at a neighboring institution here, American University in Washington, D.C., he refers to this as the sandwich strategy. So the idea is that the providers are in a sandwich between that bottom-up pressure from the citizens and the top-down pressure from the health bureaucracy to focus on being responsive to social accountability. So let's think about what we can apply here. So I think some policy examples that we could consider are municipal refuse collection and recycling, education and school management, and then thinking about the current situation with COVID-19 and the pandemic, and police reform, the Black Lives Matter situation currently. So what I'd like to end here with is, do we think that those social accountability tools would be useful here? And these are the three of them: the complaint survey, the multi-stakeholder forum, and the service charter. And so while you think about that, and I know that we've got our panel discussion afterwards, so if people can think about that a little bit, I'm going to end here with a few final thoughts. I think we can see, and this I think holds whether we're talking about Indonesia or the US or other countries, that public service delivery success depends upon citizen engagement. And that both practical experience and the larger public administration literature converge in recognizing that public service delivery success depends upon this. And this is what's commonly called co-production of public services. But that engagement doesn't necessarily rise to the level of the hard accountability that I was talking about without the alignment of provider perceptions and attitudes. And so this raises, for me at least, the question that some in studying social accountability have questioned whether the idea that you can think that citizens have a sufficient level of shared interest and demand so that every citizen is kind of wanting the same thing from their service providers. So I think that's something that's relevant in developing countries. It's certainly very relevant here. And I think those examples that I listed in the US, we can all think of very different perspectives on what kinds of reforms might be important. And this gets to my last point, which is recognizing the political power aspects of social accountability. uh, poor communities that are trying to get providers to respond to their needs and their perspectives are often at a disadvantage relative to those who have more political power, more leverage, and more sway with local officials. So this is certainly true in Indonesia, and I think it's equally true here. So I will end there. There's the published version of that study. That's an open access publication. You can download it for free if you want. And that's it. So I will stop sharing the screen here and turn it over to our panelists.
Yes, well, thank you so much, Dr. Brinkerhoff, for your presentation. I'd actually love to just jump right into an audience question, if that's all right, although I do have my panelists messaging me. We have quite a few questions.
Okay, sure.
So someone from the audience is wondering, were the prior attempts to strengthen social accountability mechanisms the same in all locations? Which types of essay mechanisms was your survey evaluating?
Yeah, that's a good question. So no, they weren't all the same. I don't have at my fingertips exactly what all they did try, but it was a combination of, I'd say probably the one that was most often tried was this idea of sort of like a suggestion box complaint survey. But I think as we've seen, and this was true in a project that I worked on in the Philippines, where the health facility had a suggestion box, but most people didn't take the time to put something in. And so that's not really a very good measure of whether people are happy or not. If you look in and say, oh, look, the suggestion box is empty, so everybody must be happy with what we're doing. It really takes a little bit more engagement than that. I think the other one, and this was definitely a challenge in Indonesia. I think it's less so here, is sharing basic information. Indonesia is pretty well connected online, and everybody has a smartphone and that kind of thing. And a lot of government offices have websites and all. But I'd say your average citizen isn't necessarily aware of all the rules and regulations that apply to healthcare and what they're entitled to and that kind of thing. So there again, you can say, well, they made information available, but the extent to which there was sort of citizen uptake on that is hard to really evaluate.
Wonderful, thank you. And I'll go ahead and Kevin, would you like to ask your question?
Thanks, Maddie. My question is, what are some specific ways we can get providers to recognize the benefits of citizen engagement? Because I think that's really important, to figure out.
I think the fastest way to get providers to be open to citizen engagement is when they can see that there's an instrumental impact on the service that they're providing. So I think a good example right now in COVID is mask wearing. So if citizens are wearing masks, they're essentially helping the health system cope with the pandemic. And so if you look, for example, it was just on NPR this morning, a comparison between the state of South Dakota and the state of Vermont, where each of those governors have taken a very different perspective on sort of pushing citizens to take the sort of the basic precautions that are out there around mask wearing, social distancing, and staying home. So I think if you can get citizens to participate in that, then providers are going to say, wow, this is great. So we're really, you really are engaging in that's a classic example of co-production. Schools are another one. And there's been lots of research on this, both from the sort of the education side and the public policy side, is that schools do a whole lot better if you've got parents who are very well engaged with their child's learning. And so there you've got, again, an example of where citizen engagement improves the quality of the service provided and makes it easier for the providers themselves.
Wonderful, thank you. I'll go back to an audience Q&A or question. Vanessa is wondering, how can social accountability help to improve or resolve the learning crisis we are all witnessing in our society?
Wow, yeah, that's certainly a big question. I think it relates a little bit to what I just said, is that, you know, if you engage parents in their child's learning, and wow, you think of now with parents shouldering the burden essentially of managing their child's school day from home in places where education is virtual, they're even more engaged in that, and that's certainly been challenging. I think the one of the public policy issues around that is the whole inequality question of, I mean, obviously for poor kids who are in a home where there's maybe limited or spotty internet access and school is taking place online, and kids who come from wealthier families where, you know, the parents have the internet connection, where they're you know, got a lot more books, a lot more, you know, of all those kinds of things. So how do you address those kinds of issues when you're thinking about engaging citizens? And I think the, you know, efforts to try to provide those to the lower end of the socioeconomic spectrum who don't have all the advantages of those at the higher end is, I think, a real public policy issue that is true in education, true in healthcare, and, you know, true in lots of dimensions. And you know, I think we're all wrestle with that in this country and also in a place like Indonesia as well.
Wonderful, and I'll turn to Camila. I know she has a question in regards to, you just mentioned healthcare and I believe another topic.
Thank you so much, Maddie, and thank you, Dr. Pintoff. My question is, recently there have been a lot of social issues within the US in regards to a lack of accountability or justice for access to healthcare during this pandemic, for example. In what ways can social accountability help promote change?
You're fading away a little bit at the end there, but I think you're basically asking, how can social accountability help with those problems? Is that right?
Yes.
Yeah, okay. I think you know, where I ended there with the sandwich strategy, I think is kind of key, because I think, as we know, if there's no connection between what citizens are asking for and any set of incentives or sanctions, you know, it's ultimately up to the individual provider to say, well, maybe I'll listen to them, maybe I won't. But if you've got, you know, a set of rules and regulations that say you need to do this, you need to listen to citizens, you need to take into account, you know, whether they're happy with the service or not, then you've got a much stronger case for social accountability. So I think the places where it tends to break down is if you just say, well, you know, we'll just turn everything over to the citizens. And I mean, in a way, that's placing a huge burden on citizens. And unfortunately, in a lot of poor countries, that's kind of what happens. Services are not evenly distributed geographically. So if you're in a poor rural area, you're going to have a much harder time even getting to a health facility, if you take the health example, and then getting those providers to respond to your needs. Whereas if you're in an urban area, one, there are a lot more providers around. Two, it's a lot easier to get to a facility. And three, if you go to one and you're not happy there, you've got the option to go to a different one. And that's, you know, sort of the classic market model is, you know, if there's a market for the service and then people find that nobody's coming to your facility, you begin to think, well, maybe we're not doing something right here. So maybe we need to change.
Thank you. Back to the audience. Paula is wondering, how does empathy play into social accountability? In a class that she had, many students agreed that for SA to work, a society needs to have empathy. Can you speak on this and elaborate if possible?
Yeah, I think that's a really good point. And I think one of the areas where there has been some interesting psychology research that intersects with essentially the public policy realm is the extent to which empathy and people's attitudes and behaviors, how that impacts how policies are implemented. And I think there are studies that show that providers who are more empathic tend to end up with better outcomes because one, they listen to people, and then people also respond better to them. So you've got almost like what's called kind of like a virtuous cycle where you get good response. And I think one of the challenges that we've seen in the US is as healthcare has become increasingly bureaucratized, and where doctors spend more time filling out forms than they do talking to patients. This is a real challenge. And in fact, we've seen in some cases where doctors simply say, I can't do this anymore. I didn't sign up to be a bureaucrat. I wanted to help people. And so figuring out how you can capitalize on people's empathy and not have it sort of squeezed out of them through the system that they're in, I think is a big challenge. So maintaining a bureaucracy, and we all recognize that that's necessary, but one that doesn't squeeze care out of the system.
Wonderful. And next, I want to ask Maya, would you like to pose your question?
Yeah, thank you so much for presenting today. It was really informative. My question is how do we increase information to the general public about social accountability? And what measures can we take to increase their awareness about what rights they have?
Yeah, that's a really good question. And I think one of the things that I've seen is that just kind of putting information out there. Yeah, that's a step. But often people need someone who can kind of interpret what it means. And so there's, in a lot of countries, including our own, there's sort of a category of nonprofit organizations that specialize in essentially taking highly technical information and translating it into things that the normal person on the street can understand. Think about things like in the US, the League of Women Voters, for example, has had a long history of trying to interpret, election issues and things that end up on ballots so that people can kind of understand what's going on. And so if you can support organizations that provide that kind of information, then you're in a better place. I think what we're seeing now is the challenge of people tending to believe things that are not factually based anymore. And so the whole issue around alternative facts, if you will, and people being swayed by sort of ideologically driven arguments. And I think in this country, in the health arena, I think one of the ones that has been particularly problematic and is likely to remain so as we end up with a vaccine for COVID-19 is the whole anti-vaxxer movement. So if you go from those kinds of perspectives, that's going to have a huge public health impact because the only way that vaccines actually work is if you get enough people vaccinated so that you can develop that herd immunity.
Yes, definitely. I want to actually turn to Daisy. I think she has a sort of follow-up to your response.
Thank you, Maddie, and thank you, Dr. Brinkeroff. I kind of just wanted to touch base on a lot of this requires citizen engagement and citizen, collective actions to participate in this sort of research and the social accountability skills. But I kind of wanted to ask, for those citizens that do have negative experiences, how can, the state or local government sort of remedy this lack of trust and this lack of relationship? Because I think a lot of citizens do have these negative experiences. So I kind of just wanted to know if you can elaborate on that.
No, I think you're absolutely right, and sort of one of the issues is social accountability really demands quite a lot of citizens. If you're going to go participate in a multi-stakeholder forum, if you're going to go to, like a school board meeting, all of these things take time, and people have busy lives. They're out, earning a living, taking care of their kids. So there's a burden in doing this kind of activity, and even more so if you take the time to go to these things and then you're either ignored, rebuffed, or turned away. Certainly your motivation to keep that up is not going to continue. So again, one of the ways of addressing that is, as I mentioned, these sort of intermediary organizations are often the ones who can attend some of those meetings either on their own and then report back to citizens, or citizens can go along with them, and then you've got the person from that organization who's an expert who could do those kinds of engagements with public officials. There's a case of an Indian NGO that essentially specialized in analyzing budgets in India, and they were driven to do this because there's a category of citizens in India that are, as you may have heard, the sort of the ones at the lower end of the socioeconomic spectrum, called scheduled castes and all, and the budget of India is supposed to actually spend money on these people, and yet somehow this wasn't happening. So this NGO decided, well, we're just going to analyze these budgets and see what really gets spent. And they became so good at it that legislators from the states would contact the NGO to find out what was going on in their own state around the budget. So that's certainly one I think good example of where nonprofit organizations can develop really strong expertise to help buttress citizen engagement. Because often, if you don't have an uninformed perspective that you're trying to present to public officials, it's pretty easy for them to say, yeah, you really don't know what you're talking about. So the extent to which you can arm citizens with accurate information, then they're more likely to be listened to.
Great. Another audience member asked, when you were identifying past social accountability capacity building programs, did you only look to programs that work directly with ministries, or did you look at civic education programs in universities and programs that establish social accountability co-learning processes in local governments and in the legislature?
For this study, we limited ourselves to the health sector and chose these facilities because the project that we were working with had access to them. So so there's always the logistical questions in terms of doing research that you want to have access to doing the kinds of interviews that we needed to do to collect this kind of attitudinal and perceptual data. So we really didn't cast sort of the broad kind of net that question suggests. That doesn't mean that wouldn't be a worthwhile thing to do, but I think that would be for a different survey and a different study.
Wonderful. Another audience question by Paula. Much social research talks about how policies and laws that work in one country may not work so well in the United States due to the society's culture of individualism. Can you elaborate a bit more on this standpoint in regard to essay practices used in the Indonesia case study being replicated in the United States?
Well, I think you can kind of separate the tools from, to some extent, from the particular contextual situation. I mean, obviously, how it's going to work will be an interplay between the tool and the context. But I think all of those tools that I listed, a complaint survey, a multi-stakeholder forum, which is essentially a cross-sectoral working group of some sort, service charters. These are all tools that have been used in lots of different countries. So there's sort of a broad base of experience with those. But obviously, how well they work is going to be dependent on how well they're applied. So as I say around the complaint one, if you just put a suggestion box on the wall and assume you're going to get a lot of information about how people feel about your services, that's probably not going to be a terribly effective way of gathering information. So much more used in studies that try to get at how citizens feel about healthcare, for example, is if you have someone who actually interviews people right after they've received a particular service. But that's obviously a lot more resource intensive and more difficult to replicate if you're doing a lot of centers. And that's why, again, in this particular project, we had the advantage of working with districts where there were already teams of people introducing these tools and working with them on the ground. So we really were able to do that. Obviously, these were not, statistically representative from a sampling perspective. But obviously there are limitations to any kind of study like that.
Yes. Paula says thank you. So I'd like to turn to Jen. Jen, do you have a question you'd like to ask Dr. Brinkeroff?
Yes, thank you, Maddie. And thank you, Dr. Brinkeroff, for answering such great questions and giving such great answers. Sure. For my question, I'll be focusing on COVID-19, not as a social issue, but more as a context. Do you believe that COVID-19 has impacted citizens' ability to engage civically? Or has it in like a harmful way, or has it benefited them with the increased use or more reliance on social media for increasing transparency?
Yeah, that's a really good question. And I think in a way, probably the answer is both. I think what I've seen, and I've been engaged in a number of, sort of Zoom seminars and all kinds of things. And it's been a lot easier to have people from all over the world participate in things that wouldn't have been possible before, where, I mean, being located here in the Washington, D.C. area, there's always that sort of bias that when you have events, you get people from Washington and not anybody else. And maybe there's a few people who kind of call in. But I think now with the focus on, technologies like Zoom and WebEx and all, it's a lot easier to bring people in, and in a way that's a lot more effective. It's not just you have a big conference and then 2 people call in for something. No, everybody's in the same boat. And so the engagement happens that way. On the other hand, you can say, well, there is certainly a benefit to showing up physically. But I think in the current environment, there are a lot of barriers to that, both on the parts of public officials and figuring out, well, we're gonna hold a zoning board meeting, but by the way, we can only have 25 people in the room, and everybody has to sit 6 feet apart and all that. So I think in that sense, I'd say kind of the balance sheet really tips to the social media side. And again, as I raised in my education example, obviously there's the question of, well, who has access to that? So if you're trying to get a representation for poor and disadvantaged communities engaging with public officials, they may not be the ones who have as much access to, to Zoom or other kinds of mechanisms.
Thank you so much. And for the final question, I saved this one to kind of wrap up the webinar. Angela is curious, what career advice can you give to students who want to potentially pursue an international public service career?
Wow, yeah, that's a big one to end on there, Maddie. Yeah, I think one of the things is to recognize that a lot of countries now have quite a bit of technical expertise in a whole lot of areas that you as students are studying. So the idea that you can go work in a place where nobody knows what you know or know about is not really the case. So I think what you need to look for is, are there particular aspects of what you're learning that you feel represent a gap that's in a particular country setting, or recognize that the role that you may end up having might not necessarily be sort of at the forefront of service delivery or community organizing or whatever, is that you would have more of a support role and a support function. And that's essentially in RTI. We have a lot of USAID funded and Gates Foundation funded projects and things like that. And over my career, I've seen projects go from where the person who was the project director in the country was most often an American or someone from another advanced economy. Pretty much all of our project directors now overseas are people either from the country or from the region. So it's not a question of where the people coming from the US are the ones bringing the technical expertise. It's a question of combining that expertise with the expertise in the country to solve a particular public policy or public administration problem. So obviously, learning about different parts of the world is good, and if you speak another language, that's good too. But I think recognizing that you're not going to be stepping into a situation where everyone is going to be looking to you for the expertise. You're going to be working with people who already know a lot and are looking for a partner in that.
Thank you so much. Well, unfortunately, this is all the time we do have for questions. I would like to once again thank you, Dr. Brinkerhoff, for generously spending time with us today. And thank you to all who attended today's webinar. Our next online event will be on December 3rd, when we will host Ms. Rose Hayes, the Executive Director of the Fair Housing Council of Riverside County, for a Black Lives Matter related seminar. You can learn more about UCR School of Public Policy events like this by visiting spp.ucr.edu. Thank you again, Dr. Brinkerhoff, and I hope to see our audience members at a future event.
Okay, thanks very much, Maddie. Appreciate that. And enjoy seeing the backdrops of UCR on your screens there. Very nice.
Thank you.
All righty. Bye, everybody.